When I started doing this operation, the death rate was somewhere around 4%. But right now, it is more like 0.1%.
I was going to ask you, Doc, you, when I was going to do major back surgery, the neurologist threw the textbook in my face.
Yes.
And he was very blunt that, look, Divine, you could become impotent after the surgery. Or you could end up in a wheelchair. Thank God none of those things happened. Because then I would have just gone to perhaps a seminary. But the question I want to ask you, sir, is what are some of the things, the complications that could arise during the process of bariatric surgery that you would want patients to know?
Well, in the hospital, the things that can occur are simple. You can end up bleeding. You can have an infection. You can have what we call a leak. That means the juice from the intestinal tract leaks into the abdominal wall. You can have a blood clot because you're lying down in that operating room for too long or lying around the hospital for too long and you get a blood clot in your legs. We call it deep venous thrombosis. Or you can have the blood clot go to your lungs where you have what we call a pulmonary embolism. So those are the main things: infection, blood clots, and bleeding. Those are the common things that can happen in the hospital. The rest of them can happen later. And those are things like electrolyte imbalance, losing too much weight, having an obstruction, having a hernia, and all of those things we can manage.
We'll talk about post-surgical care. Doctor, here is the question somebody just sent me by text. Have you had situations that patients did the bariatric surgery but reverted to you later because it just didn't solve the problem? It got them to square one. What got them to doing the surgery in the first place?
Yes, you're dealing with human beings. We have done surgery in patients who had the surgery and lost the weight and were very unhappy. And so we have had to reverse the surgery, which we rarely do, but that has occurred. We have had patients who had surgery and developed complications from the surgery and have had a very miserable life and are living with those complications. That's just part of the parcel. For instance, one of the common procedures we do is called a gastric bypass, where you move the small bowel and bring it up to a small pouch. In this surgery, there's a possibility of something called an internal hernia. And when you have that hernia, you can end up having bowel that twists around itself and the bowel dies. And you have to go in and take out most of the bowel of the patient. We don't want to have that happen. So we do things to prevent it, but it does occur in a very small percentage of patients. And a patient like that, when they lose a lot of their bowel, they might have to be on IV therapy for the rest of their lives. So there are things that can occur. And when you come and have surgery, we discuss all these possibilities with you. You know, we, the surgeons, don't want you to have any problems, particularly in the United States with the medical legal consequences. So we do all we can to minimize those problems, but they do occur, even in the best of hands. And even with me, I've had patients who died from complications of having bariatric surgery. I did all I could, but I couldn't save it.
Critics of bariatric surgery, Professor Fobi, describe it as a band-aid on a lifelong problem.